Prevention of veteran suicide continues to be the VA's top clinical priority, and now veterans who are facing acute suicidal crisis have expanded options to receive immediate medical care during periods when they're the most vulnerable. Now, here to tell us more about the Compact Act is Dr. Wes Houston from the Cincinnati VA Medical Center. Dr. Houston, thanks for being with us today. And for those who are unfamiliar, what is the Compact Act?
Great, thank you for having me. The Compact Act allows for veterans in suicidal crises to receive emergency mental health care at any VA facility or any community medical facility. And that care extends to up to 30 days of crisis residential care or inpatient care, or up to 90 days of outpatient mental health care, including social work services.
So what does this all mean for veterans?
So the Compact Act's goals are to increase suicide crisis related care to an additional 9 million veterans who are not receiving VA health care at this time, but also to reduce veteran suicide by providing treatment immediately to veterans who are most vulnerable.
And Dr. Houston, what is an acute suicide crisis and what is emergent suicide care?
Okay, good questions. An acute suicidal crisis occurs when an individual has been determined to be at imminent risk for self-harm. Now, imminent risk can be determined in a number of ways, but one way it may be determined is if the individual themselves expresses either a desire or intent for self-harm, but it can also be determined by a provider who has information about either past or present behaviors that an individual has that signal an increase in risk for self-harm, and that includes previous suicide attempts. Emergent suicidal care, this really refers to the urgency of providing care to an individual in order to ensure that individual's safety. But it also refers to the actions that we take to reduce distress, the severity of distress, and the need for that urgent care.
Who's eligible to benefit from the Compact Act?
So veterans do not need to be enrolled in VA healthcare to be eligible for Compact Act benefits. Any veteran who is diagnosed or determined to be in a suicidal crisis who meets military service eligibility criteria is eligible for Compact Act care and benefits. And that includes care that is provided by or paid for by the VA regardless of enrollment.
And Dr. Houston, what should a veteran do if they receive a bill after receiving emergency care during or after a suicidal crisis?
So if a veteran receives a bill during or after a suicidal crisis, the VA has established an expedited review process to make sure that the costs are applied appropriately. It's important for veterans to know that we're here for you, and we want to ensure that you can receive the emergency care that you need without worrying about a bill. We want all veterans and former service members to know that they can get the emergency suicidal care that they need when they need it and where they are. Suicide prevention is really everybody's business. And so we encourage people to talk to friends and family members about the Compact Act and to talk about its impact on veterans. We know that there are veterans who need to hear from trusted sources when they have concerns, and we believe that saving veterans' lives starts with you.
Dr. Houston, we want to do our part to help save lives. Where can people go for more information?
Call the Cincinnati VA Medical Center at 513-861-3100 or go to the Cincinnati VA website, which is cincinnati.va.gov.